Good afternoon to all the attendees of PAtalk Public Policy 101. Thank you for inviting the DOH in this event so that I may share insights on the resiliency of Filipinos during this pandemic, as well as the pertinent updates on the COVID-19 pandemic and other must-knows about the National Vaccine Deployment Program. I would also like to recognize the efforts of the following people in spearheading this initiative to provide the new era community with this vital information in this public health emergency. Ms. Rosaline Culiado, NEPA's President, Dr. Ray D. Nara, NEPA's Advisor, Dr. Ariel Lladones, BPA Program Coordinator, Attorney Serafin Cuevas Jr., Vice President for Legal and External Affairs, Dean of the College of Law, Brother Julian Meimban III, Vice President for Research, Brother Franklin Bunag, University Vice President for Administration, Dr. Nilo Rosas, University President, the New Era University, and the Iglesia ni Cristo Administration. Next slide, please. So let me begin by giving a brief situation of COVID-19 in our country. As of March 29, the Department of Health has recorded a total of 731,894 COVID-19 cases nationwide, of which 115,495 or 15.78% are active cases. Majority or 98.62% of these active cases were diagnosed as asymptomatic, mild, and moderate cases. Meanwhile, 1,598 or 1.38% are classified as severe or critical cases. As of March 29, we have also recorded more than 603,000 recoveries. Our case fatality rate of 1.8% remains to be lower than the global case fatality rate of 2.2%. For the past weeks, we have observed an increase in the number of COVID-19 cases nationwide. We have surpassed the peak that we saw last August, with cases coming mostly from the National Capital Region and Region 4A. Aside from the continuous rise in the number of COVID-19 cases, we also have observed our healthcare facilities are becoming overwhelmed. This is why the IATF has decided to implement an enhanced community quarantine in NCR and its neighboring provinces such as Bulacan, Laguna, Rizal, and Cavite. This enhanced community quarantine aims to slow down the surge of cases, stop the spread of the variants, allow the health system to recover, enhance the implementation of response strategies and protocols, and eventually to protect more lives. For the past year, it has been evident that a national government-led, a local government-led approach to a people-centered response is needed to solidify our strategies for COVID-19. Recognizing that defeating the pandemic necessitates a response continuum, we have adopted the prevent, detect, isolate, test, treat, and reintegrate strategy, which remains to be the cornerstones of our COVID-19 response. We also have integrated the National COVID-19 Vaccine Deployment Program in these said strategies, since this is also a necessary tool in defeating the pandemic. The prevent strategy is mainly anchored on the characteristics and behavior of the coronavirus. COVID-19 is an infectious and communicable disease. This means that the infectious agent can be transmitted from one person to another, mainly via the droplet transmission. This is why our first line of defense from getting infected, whatever COVID-19 variant it may be, is ensuring that we practice the enhanced public health standards through the BIDA Plus strategy. We had been implementing the BIDA strategy in various barangays and institutions for the past year, but I would just like to reiterate some of the important aspects because we have observed a decrease in compliance with these standards. First, it is no longer enough that we just wear a mask. We must wear it and ensure that it is worn properly along with your face shields. In wearing your face mask, make sure that your face mask covers your mouth and your nose and avoid touching it. Do not reuse disposable masks. Replace it daily when damaged, soiled, or moist. You may wash your reusable cloth mask with hot water and detergent and dry them under direct sunlight. It is no longer enough that we wash our hands. It must be done properly by washing our hands with soap and water for at least 20 seconds. You may use 70% alcohol if soap is not available. It is not enough to physically distance ourselves from people that we meet. We must ensure that there is good ventilation and the time of interaction is kept to the minimum. It is not enough that we know the right thing to do to protect ourselves from COVID-19. We must educate other people too. It is not enough that we are bida for ourselves. We must be bida bastonero for the people that we love and for all of our kababayans. Aside from the proper wearing of face mask and face shield, frequent hand hygiene, and physical distancing, we are asking for everyone's cooperation to please stay at home. Go out only when necessary as part of our preventive strategy. To prevent household transmission and lessen clustering in communities, we recommend individuals to use a mask at home when not alone, especially if you are living with those at risk. Ensure that there is adequate ventilation by regularly opening your windows. If you feel COVID-19 related symptoms such as fever, coughing, and sore throat, or if you had been exposed to a COVID-19 case, isolate yourself, consult a doctor, and inform your barangay health emergency response teams. We also advise the public to go to the isolation facilities first, especially if they are just experiencing mild symptoms, so that our hospitals will have enough space for those who are experiencing moderate to severe symptoms of COVID-19. Detecting the presence of the COVID-19 virus through testing is one of the cornerstones in providing the appropriate management in each COVID-19 case. Hence, the expansion of our laboratory capacity aided us greatly in our pandemic response. Last February 1, we just had one laboratory. Now we have a total of 239 licensed COVID-19 testing laboratories across the country, composed of 182 RT-PCR and 57 gene expert laboratories, while 40 more are undergoing evaluation. We also have increased our testing capacity from just 300 tests per day in February to an average daily output of 50,967 samples tested for the past 7 days. As of March 28, we have conducted more than 10 million tests and tested more than 9.4 million individuals. Due to the discovery of the new COVID-19 variants, we also have started our own genomic biosurveillance. We are conducting genome testing of COVID-19 samples with the University of the Philippines Philippine Genome Center. To date, we have sequenced a total of 4,310 COVID-19 positive samples, and we continue to sequence samples which have met the inclusion criteria as part of our ongoing investigations. Aside from testing, the management of COVID-19 patients is equally important. This is why we have also increased the number of temporary treatment and monitoring facilities nationwide for isolation of COVID-19 patients. This also serves as a step-down facility for those who are recovering to decongest our hospitals. For our isolation facilities, from just one quarantine facility in New Clark City that only catered to our repatriated Filipinos during the early COVID-19 response, we now have a total of 9,797 temporary treatment and monitoring facilities all over the country, with a total bed capacity of 128,410 and a 16% occupancy rate as of March 27. We also have a total of 10 mega temporary treatment facilities in NCR, regions 3 and 7, with a total bed capacity of 2,490 and a 75% occupancy rate. To prevent our healthcare system from being overwhelmed and to facilitate the proper referral of COVID-19 cases to appropriate facilities, the Department of Health instituted the One Hospital Command Center, where Filipinos can call so that patients may be assigned to a health facility. Again, asymptomatic and mild cases should go first to temporary treatment and monitoring facilities so that individuals with moderate to severe COVID-19 will be accommodated by our bigger hospitals. As of March 28, our national healthcare utilization rate is as follows. We have a total of 10,453 ward beds, for which 44.2% are occupied, a total of 17,756 isolation beds with a 44% occupancy rate, 2,286 ICU beds with a 56.8% occupancy rate, and lastly, we have 2,326 mechanical ventilators where 35% are currently being used. With the increase in COVID-19 cases, especially in the National Capital Region, the Department of Health would like to remind that COVID-19 suspects, probable and confirmed cases must complete 10-day isolation for those who are symptomatic and 14-day quarantine for those who are asymptomatic or those who were found to be close contacts, regardless of RT-PCR results. This period of observation was prescribed by experts to ensure that ample time is dedicated to wait for the development of symptoms among COVID-19 asymptomatics and close contacts in the event that they are truly infected. Again, there is no need for repeat RT-PCR testing to be classified as recovered, since RT-PCR are very sensitive tests that can still detect even the non-infectious remnants of the COVID-19 virus up to 8 weeks. Upon discharge, previously infected COVID-19 individuals are still advised to follow the enhanced public health standards as with the rest of the population. Aside from the clinical aspect that must be fulfilled upon reintegration of COVID-19 patients in the community, we have to consider the psychosocial effect of the COVID-19 pandemic. This pandemic has had a major effect on our lives. Many of us are facing challenges that can be stressful, overwhelming, and can cause strong emotions both in adults and in children. Public health actions such as social distancing are necessary to reduce the spread of COVID-19, but they can make us feel isolated and lonely and can increase stress and anxiety. Learning to cope with stress in a healthy way will make you, the people you care about, and those around you become more resilient. First, we have to remember that epidemics and disasters are events that put people in extreme stress, and the physical and psychosocial reactions are normal occurrences. Sabi po nga nila, it's okay not to be okay. These reactions include being sad, afraid, worried, angry, or confused, and although they are generally unpleasant, they are just normal. Everyone has to be reminded that it's okay not to feel okay, and that talking or venting to someone you trust is helpful in overcoming negative feelings due to stress. If you think that talking to your friends and loved ones is no longer enough, you can always seek the help of a mental health professional. Individuals should not be afraid of feeling judged and stigmatized when they do this. After acknowledging your feelings and your emotions, you also have to take care of your physical needs by having proper nutrition and by engaging in healthy activities that you enjoy and that you find relaxing. For diet and nutrition, we recommend women to eat nutritious and well-cooked food, avoid drinking alcohol or keep it to a minimum, eat a variety of food including plenty of fruits and vegetables, and to limit the intake of sweets and sugary drinks. To maintain or improve physical fitness, it is advisable to regularly check your sitting posture while you work at home, try online exercises and videos, and do some strengthening exercises. It is also important to get enough rest and good sleep and to find a quiet time for yourself. These self-care activities can be reinforced by spending time and enjoying moments with your family and loved ones to maintain mental resilience during these trying times. Now, let me briefly discuss some of the must-knows for the COVID-19 vaccination, since this is one of the most essential public health measures that will help end this pandemic. The National COVID-19 Vaccine Deployment Program aims to have a safe, equitable, and cost-effective immunization for all Filipinos by 2023. To achieve this, it is our mission to institutionalize an end-to-end immunization program for COVID-19, which will protect the public and reduce COVID-19 cases and deaths, effectively reducing the strain in our healthcare system. As of March 28, 2021, 53.1% or 665,621 out of the 1.2 million plus master listed eligible population for priority A1 or healthcare workers had been vaccinated in 2,497 vaccination sites across the 17 regions of our country. In order to facilitate the national COVID-19 vaccine deployment program, the COVID-19 vaccine cluster uses a whole-of-government approach and has groups each led by different government agencies. Our national deployment and vaccination plan for COVID-19 consists of 7 primary chapters, led by different task groups from DOH, DOST, DFA, DOF, and PCOO. We also have several expert groups that guide us in each of the process for vaccine acquisition. We have the Vaccine Expert Panel, which advises the government on the research and development of vaccines. The Health Technology Assessment Council, which aids us in determining which of the vaccines should be chosen based on its efficacy and cost effectiveness. The National Immunization Technical Advisory Group, or NITAG, helping us improve our strategies for health service delivery, and the National Adverse Effects Following Immunization, or NAFIC, that advises on the management and investigation of adverse events. We would like to emphasize that due to the limited supply of COVID-19 vaccines globally, we have utilized a prioritization framework with the guidance from the World Health Organization and advice from our experts. The primary goal of the COVID-19 vaccination program is to reduce morbidity and mortality of COVID-19 while maintaining the most critical essential health services. In the context of scarcity, vaccines must be given first to those with higher risk of exposure and death. This includes frontline healthcare workers, senior citizens, and persons with comorbidities. Currently, we are already in the process of master listing these priority groups so that there will be simultaneous vaccinations in these groups, especially in this NCR plus bubble. For Criterion 1, the identified priority group that shall be given access nationwide before the next priority group. If the incoming supply is less than the number of people in the population group selected for vaccination, there will be further prioritization based on Criterion 2. For Criterion 2, we consider the geographic location based on the COVID-19 burden of disease and the local government's readiness to effectively and efficiently deploy the vaccines. This principle was recently applied due to the rapid increase in the number of COVID-19 cases in the National Capital Region and its neighboring provinces. DOH, along with our experts from NITAG, have decided that due to the high burden of disease in NCR, more doses should be allocated in this area to prevent an increase in morbidity and in mortality. If the incoming vaccine supply is still less than the number of people in the population group selected for vaccination in that specific region, then further sub-prioritization may be employed based on Criterion 3. Criterion 3, we consider sub-priority groups based on the exposure and the mortality risk. The national government can adopt similar sub-prioritizations by other countries or reputable health institutions such as Centers for Disease Control. For example, we started off with the COVID-19 designated hospitals and those directly providing frontline care, which is what we have done for the past month. And we can start those with higher exposure risk if we are going to start with the sector for indigents. Let me share with you the frequently asked questions about the COVID-19 vaccines to increase vaccine confidence. So why do we need to get vaccinated? Vaccines mimic the virus or the bacteria that causes diseases and triggers the body's creation of antibodies. These antibodies will protect the body once a person is infected with the actual disease-causing virus. The COVID-19 vaccines that were given an emergency use authority have already been proven to prevent severe infection. Thus, it can reduce mortality. Immunization is also needed for us to attain herd immunity, which means that even those who are not vaccinated will enjoy the same protection if 70% of the population is immunized with the COVID-19 vaccine, according to our experts. In this regard, having yourself immunized with the COVID-19 vaccine does not only protect you, but also protects the people around you. So which vaccine should we use? Only COVID-19 vaccines that was granted either an emergency use authority or a full approval from the Food and Drug Administration are considered safe and effective. Hence, only vaccines with EUA will be deployed in the national COVID-19 vaccination program. At present, this includes AstraZeneca, Pfizer, Sinovac, and Gamaleya Sputnik V. All COVID-19 vaccines will be shouldered by the Philippine government and will be given free through the National COVID-19 Vaccine Deployment Program. So what do I do before being vaccinated? Make sure you obtain accurate information from the right sources, experts who are licensed professionals. Always verify what you read and you hear from others. On your scheduled health screening, you have to declare your complete medical history. This is important to determine which vaccines are appropriate for you. Go to your assigned vaccination site as scheduled, wear your face mask, your face shield, and stay at least 1 meter away from others. You have to sign the informed consent signifying that you are aware of the benefits and risk of the vaccine and you are willing to get vaccinated. So on the day of vaccination, healthcare workers will monitor you for 15 to 30 minutes before you can go home for any unusual symptoms or adverse events. All vaccinated Filipinos will be monitored for 12 months at the least after they get their shots. So what do I do after being vaccinated? The usual symptoms may be experienced, including pain, redness, and swelling on the injection site, as well as flu-like symptoms. These are normal signs that your body is building up protection. If discomfort increases after 24 hours or your unusual symptoms are worrying you, you can report to the nearest health authority for proper management. So the health authorities will investigate if the symptoms or adverse event you experience is caused by the vaccine or just a mere coincidence. You may contact this number for any concerns. So after vaccination, can I go back to not wearing face masks and face shields? The answer is no. The COVID-19 vaccine is just an additional tool to protect yourselves from COVID-19. Even after being vaccinated, you still need to practice the minimum public health standards to provide continued protection for yourself and your family. This way, we can be safer from the threats of COVID-19 transmission and its variants. So how do I ensure that vaccines I get are authentic? Only COVID-19 vaccines with Philippine FDA authorization are transported under strict cold chain conditions and are able to provide full protection for those who are vaccinated. So what do we need from you? This is going to be my last slide. I am inviting every one of you to be advocates of the right information. Let us contribute to our nation's vaccine deployment program by increasing vaccine confidence in our country. We also encourage everyone to report fake news so that this can be debunked. We have observed that enlightening the public with the correct information helps drive vaccine confidence. Hence, we are appealing that you help us disprove false and malicious claims about the COVID-19 vaccines to further increase our acceptance rate. You may always refer to the DOH website, Facebook, and Viber groups for reliable and validated information. Lastly, with the appearance of the new variants and the rise in the number of COVID-19 cases, we call on everybody to follow the enhanced public health standards. Thank you for listening and good afternoon to all of you.